Hello and welcome to webinar series. So myself Shanti, and today's topic for discussion is all about the very basics of metabolism for wellness and well-being. And for this discussion, I now invite our expertise, none other Dr. Sri Karan Udeshji, who is our senior consultant and general physician from Yashoda Hospitals, Secunderabad unit. I welcome you, Dr. Sri Karan.
Thank you.
And
Thank you.
yes, we are very grateful that you are, with us today for this, discussion. Yeah, thank you. I now, invite and welcome all our beloved speakers to introduce themselves. Yes, over to you, Monica.
Yeah. Good afternoon, everyone. Yeah, I'm Monica Chaturvedi, working as a nurse educator in KIMS Hospital, Thane. And I would like to say thanks to Ms. Shanti Bhattacharya ma'am to giving me privilege to become a speaker of this panel.
Thank
Webinar,
you.
sorry. Yeah, thank you.
Thank you. Do we have a Srinivas here or Sumitra? Are you there, Sumitra? Okay. This session is going to be very time bound, so let us just go, get forward going with like in this today's. Yes, Sumitra, are you there, Sumitra?
Yes, ma'am, I'm there.
Yeah, could you just give your little short introduction?
Hello, everyone. My name is Sumitra, and I'm working as a staff nurse in Aishwarya Fertility Center in Chennai.
Yes, we welcome you, Sumitra. Srinivas, have you logged in? Yeah, good to see you. Yeah, unmute yourself, Sumitra. Unmute yourself. Yes. So, with the first insight we like to understand from you, Dr. Shekaran, is like what is metabolism in very, very simple terms? Like the viewers are all about a nursing team and, from different parts of the, the hospital. So, yes, over to you.
So basically, I think as the slide represents, that's a very simple definition of metabolism. But at the core level, it's the maintenance of the cellular energy flux, whether it can be ATP production, redox cycling, or production of glycolysis, It's basically a completely an energy flux that is maintained in the body. So to put it in very simple terms, whatever we are eating or consuming, how our body utilizes it to maintain the entire homeostasis of your body is basically metabolism.
Yes, I think that was a very great insight in very simple term. I think the metabolism is just like, the body's own, chef. Like, yes, yeah. So going forward, let us see what Monica has to be asked to you. Yes, over to you, Monica.
Yeah, so as you said that metabolism is just convert the food into the energy. So if we are taking the poor nutrition, so it will affect your metabolism.
Yes, absolutely. Because the ultimate driver of metabolism is mitochondria in the body.
Okay.
That's the
Yes.
fuel cell, you would say. That is where through which the entire human beings actually run. That's where the energy is produced, I think. And mitochondrial health is very dependent on our lifestyle behavior, and food is a big part of our lifestyle behavior. So that is a big part.
Okay.
So yes, so when I was just browsing through, so we also have this ATP, adenosine triphosphate. No, phosphate. It is just like the energy currency. I think that is how the total cellular and ecosystem works upon. Yes. So here we would like to also understand what are the basic, very fundamental basic functions of metabolism. Yes.
See, the basic fundamental of metabolism is to ensure homeostasis. Homeostasis is nothing but everything to be in order. Like it could be your organ function, organ perfusion, your cognition. Your basically all the functions of the organs in the body, they should be in flux with each other. They should be communicating, coordinating with each other in a proper manner. So that's basically homeostasis. So what the basic function is at a very cellular level, what we eat gets broken down into glucose, and then that glucose is converted into the energy molecule called adenosine triphosphate. That gives us energy. So that is at the very cellular level. And there are multiple pathways that actually happen in between. Like there's a certain pathway. There's so many pathways that I think it's beyond the discussion here. But to put
Yes.
it very simply, whatever you eat or you drink is going to be converted into ATP, and that ATP is going to be utilized for the cellular function. That is the fundamental thing.
So you also mean to say that, sometimes is it so that when we sleep, metabolism stops working, and when we are active, it is functioning. Is it so, or there is a little myth and misconception? Yes.
No, no. Metabolism runs 24/7, 365.
Yes.
So even
Yes.
when you're sleeping, your body is in a constant, what do you call, it's doing its, what do you call, the burning of calories, or, the hormonal health. Everything is running. There's nothing
Yes.
that is stopping when you're sleeping. In fact, sleep is one of the biggest, most important contributors to good metabolic health. So sleeping consistently at the same time and waking up again at the same time is most important. Not just the time. Of course, the time is important. You need to sleep at least for 7 hours per day. But at the same time, sleeping at the same time, like if your sleeping zone is like from 10:30 to 6:30, every day if you do that, that is actually more important, which is called sleep consistency. But
Yes.
say someday you're sleeping at 12, waking up at 7. The other day you're sleeping at 9, waking up at 5. So that is also not a good thing, even though you're getting adequate sleep. But consistently sleeping at the same time and waking up at the same time makes a big difference in metabolic health.
Yes. So do for the metabolic optimization. Yes. Over to you, Sumitra. You wish to ask your insight. Yes. Unmute yourself. Unmute yourself. We can't hear you. Yes.
Good afternoon, sir. Sir, how we can find the signs of your fast metabolism, sir? Can you explain briefly?
Actually, we call it a specific phenotype. It's called the high muscular phenotype or the lean mass phenotype. I wouldn't put it as a fast metabolism per se. In such patients or in such people, their ability to gain muscle mass or their ability to ensure that they have high energy levels is completely dependent on how much muscle mass they carry. So some individuals, despite having lean muscle mass, which is on the higher end, they tend to have a faster metabolism. Like you can see, they like somebody, they'll complain that how much ever I eat, I don't put on weight. So it is more to do with how their basal metabolic rate is. If their basal metabolic rate is high, that is, if the ATP is burning at a very faster rate, so then it gets difficult for them to put on muscle, or it's difficult for them to actually put on weight. So that's the fundamental thing. It's more to do with the genetics and the cellular pathophysiology than the lifestyle per se.
Yes, as you said, how much ever we eat, we don't put on weight, and how much ever this is my, statement as well. Whatever if you, I stick on the intermittent fasting and blah blah blah. Still, I don't lose weight. Yes, so too with the same context. So as you said, yeah, the muscular phenotype, etc. So do we also see the signs of little slow metabolism, like people they are very bound for this weight gain, and maybe they are very physically inactive, and what are the little core signs which we get to see? Yes, over to you, sir.
Yeah, so the signs of, I wouldn't see patients who are sedentary or people who are
Yes.
generally sedentary, their metabolism tends to be a lot slower. So it works vice versa. Whether your metabolism is causing the weight gain or whether your habits are decreasing your metabolism is something that needs to be determined when we talk to the person. In general, high sedentary behavior causes very low metabolism. Like it's difficult for those people to lose weight, like when you're talking about. Also, time restricted eating again doesn't work for everyone, since you brought that up. It's especially since this is a nursing population. For them, people who work in the ICUs in high stressful environments, for them I
Yes.
would not recommend time restricted eating, because their energy levels will crash and they won't be able to function in that high stressful environment.
Time complex. Yeah.
uh, TRE or time restricted eating is not for nurses working in the ICU or nurses in general, because they have odd shift hours. So it gets difficult. So that is one point, because the nursing audience I wanted to elaborate.
Yeah. Thank you for your productive key home message. Yes, over to you, Monica. Yes.
Yeah, so as you said, like body, like obesity is the one of the factor we can say the for the slow metabolism. So is that mandate the person is a lean body structure? so that the energy level will be high?
No, so in India, most of the patients or most of the people have what is called sarcopenic obesity. That
Okay.
means they look lean, but they're actually obese. They have
Hmm.
less muscle mass, but more fat content. Like you see a lot of patients, they'll be like, "Sir, मैं तो इतना lean हूँ, मेरे को cholesterol ज़्यादा है, और
Hmm.
you know, I'm just 40, but I have a stent despite me being so thin." So Indians especially have this thing called sarcopenic obesity. They look lean, but no, their underlying metabolic health is not good. That is for various reasons. One of the main reasons is ancestrally, if we look at our genes over the past thousands of years, in our belt in South Asia, uh, regularly famines would happen, and our body adapted in a way that if we had just little amount of food, instead of storing it in the subcutaneous region, it will go and get stored in the visceral fat region. So
Okay.
now that we have excess food, our body, even if we compare to Europeans or Caucasians,
Mhm.
like if we consume 100 calories and they also consume 100 calories, the way our body utilizes 100 calories is completely different from how they use it. So ours
Right.
is converted into visceral fat very quickly because of our ancestral genotype.
Okay.
So yeah, great learning again today. We are just learning few very dynamic, terminologies like sarcopenic obesity.
Yeah.
Yes. And my insight again for you, sir, like this metabolism, the good metabolism is with the male generally or with the female because of the hormonal imbalances and,
Hmm.
as they cross their little middle age. So,
Yeah.
and they do face a lot of challenges as well. Yes.
Actually, it's the same for both, even men
Okay.
or in women. But in women, we get more of that because they reach what is called menopause in their midlife. And unfortunately, due to a study done in 1993, which was not properly designed, women have been denied hormonal replacement therapy after menopause because saying that the incidence of breast cancer and incidence of other cancers has actually increased because of HRT. But after reading the fine print of that, now even the latest guidelines of American College of Obstetricians or anywhere, the Indian Menopause Society recommend HRT, especially for women who've just crossed menopause. And we kind of look at their hormonal profile, their estradiols, testosterone levels, everything. Even in females, the testosterone level is important, not just in males. And coming
Yes.
to males also, after 35, even their testosterone levels start dropping by 1% a year. So if somebody is feeling unexplained brain fog, unexplained fatigue, they have
Mhm.
to get a hormonal check. And unexplained weight gain, whether it be male or female. So testosterone testing or any estradiol testing is really important to ensure that their hormonal health is optimal.
Very great productive
Hmm.
insight for the awareness.
Yeah.
Yes. So this slide is also very important, which, like little few advancement when I was just going through your longevity talk and wellness, parameters, like what is happening, like no more we are, um, BMI bound, indicators, like as we see a female or male with a base circumference and other factors. So what are few kind of inflammatory markers or you suggest that DEXA scan to be done after a few certain age as a prophylaxis or little preventive for the chronic diseases. Yes, over to you.
So we've just designed, like I designed a new longevity baseline assessment thing. So in that, I advise everyone to get a DEXA scan. Everyone, regardless of their age. In fact, more than 30 is ideal, but anyone can get a DEXA scan. In that, we will know how much percentage do you have a visceral fat percentage, how much muscle mass you have, and what is your bone density as well, bone mineral density. So these three things are going to give us a very good indicator of how your body is and which phenotype you fit into. Like, do you have sarcopenic obesity? Are you just obese? There's so many other phenotypes that we categorize the patient into. And BMI is a concept. I think we should move away from it. Going to a
Yes.
DEXA scan is better because you can have a normal BMI. There's a famous picture wherein there's an Indian and a Caucasian sitting, both have a BMI of 23. But the Indian is much more at risk of getting a cardiovascular disease or diabetes or whatever lifestyle disease. So, waist to hip circumference ratio is waist to height circumference is really important rather than the BMI. And of course, triglycerides by HDL ratio is another thing. And another thing is called HOMA-IR, wherein we measure how your HOMA-IR level is to ensure whether you have any insulin resistance in your body. So the main things is HSCRP, HOMA-IR, DEXA scan, triglycerides, and HDL ratio. And also one more thing a lot of people don't know is apolipoprotein B levels, not just LDL and TGL. Apolipoprotein B levels are the ones which give you an indicator as to how your cholesterol is transported in your body. Like these are ApoB are the ones which take the bad cholesterol and travel, and they go and deposit into the artery. So ApoB levels is really important.
Yes. So these are very important nowadays in advancement. And as anybody walks to your, for your consultation, and you suggest all this, and then so do likely a lot of prevention aspects are taken care.
Yes.
Yes. Yeah, in details, I will also like to refer, and maybe sometimes I'll meet you because I'm just noting down. Yes,
Sure.
very great. And yes, Sumitra, over to you. Sumitra, yeah.
Yeah, yes, sir. So how to boost or increase our metabolism? Like what food do we have to take to increase and boost up our metabolism, sir?
See, first thing that I see in that thing is strength exercise. I think it is a prescription. Everyone or 99% of my patients come and say, when I ask them, are you exercising? Yes, sir, मैं walking करता हूँ.
Oh,
Unfortunately, that is not enough. You have to go to the gym and lift weights. Resistance training is the must. A lot of people who just walk will not lose weight or are not guaranteed to have good metabolic health. You have to go to, because the more muscle you have, the better it is for you. One of the simple reasons is when somebody eats something, there's a glucose spike. The biggest
mm,
organ which utilizes that glucose is the muscle. So if you
yes.
don't have more muscle, that is when your insulin resistance starts happening, and you start to develop all these chronic diseases that we were talking about: diabetes, hypertension, cardiovascular disease. So going to the gym thrice a week is an absolute must, non-negotiable for 60 years, 70 years, 75, anyone. They have to go to the gym. The second thing is adequate protein. Now, there's a lot of talk about how much protein. Somebody will say zero point
Mm.
0.8, somebody will say 2 grams. But
Yes,
the
yes,
window that is 1.2 to 1.6 grams per kg of protein is the ideal. If you're doing resistance training, 1.6. If you're not doing resistance training, 1.2 grams per kg of your body weight is the ideal. Drinking enough water, I mentioned, it's water is again, if you drink more water, that doesn't help with metabolism. If you're
yes,
thirsty, you just drink water. Recommendation is 2 liters or 2.5 liters per day. That's more than enough. Drinking more water is really not going to offset your metabolism. It's more to do with your protein intake. And another thing is what you're having in the form of fiber also. So at least 25 to 30 grams of fiber, and that too a 15-gram fiber taken in the morning, like in the breakfast time, is really important. So one concept I would like to tell everyone is it's called the migrating motor complex, which means basically your gut transit time starts in the whenever you're fasting. So if you
yes,
take fiber in the morning, so you'll feel more what do you call full, and it'll secrete what is called short chain fatty acids, just to put it very briefly, and that is the one that helps with gut health, gut lining, gut barrier repair, all that. So fiber in the morning is very important, not just in the evening. Taking a big dose of fiber in the morning is important, and fiber could be in any form, like fermented form. The next thing I see is quality of sleep. I think we
yes.
discussed
We've
it.
discussed, yeah.
It's
Yes,
important. Skipping meals, again, I said there are certain people who benefit from skipping meals, but this audience, I would not recommend skipping meals. But yes, there is good scientific data saying that time restricted eating can help with metabolism, especially 16/8 if we can do that. But again, you should not be working in those hours, because you can see tremendous energy crashes during that time. Of course, gut health and microbiome support is again, I mean, only the gut health I can talk for 1 hour on that. So we
yes.
not go into depth of
Yeah.
that. But all I can say is high protein, good fiber content, 30 grams per day, and protein, how much ever I mentioned, is important.
Yeah, how about that was again myth and fiction, and lot of studies which we were looking at edible sugar versus this sugar free additives. etc., etc. So, do you also recommend that rather taking simple complex sugar, should we stick to this sugar-free like stevia, etc., for just to put the microbiome and to reduce little reduction in obesity or muscle mass, etc. Yes.
There is some data saying that stevia might help, and it is better than refined sugar. But I would say rather than stevia, I think consuming complex carbohydrates which are rich in resistant starch is extremely important. Like again, I think I'll give a tip for all people who are watching.
Yes,
If
please.
you love rice, you can't stop eating rice. What you can do is you cook the rice overnight, put it in your fridge, and then reheat it in the morning and eat it. That way, what happens is by cooling it, resistant starch levels rise by at least 20-30% in the rice. And consuming that rice will not cause that big of an energy, what do you call, in a glucose spike. And
Yes.
thereby, you can maintain a steady state of glucose level. And also, you will not get that feeling of, Arey, मैं rice nahi kha raha hu. A lot of people get that.
Yes, yes,
Indians love rice. So, that is a
yes.
tip
Yeah.
that everyone can actually incorporate.
Yes. Yeah, very great tips. Yes. And yes. So, why metabolism matters for overall wellness. I think, yes, you have already tried giving a lot of, tips and other.
I think the simple question, a lot of patients, I ask them when they come to me, I'll ask them at 65, how do you see yourself? Do you want to be dependent
Oh,
on your parents? Do you want to
yes.
see me at 65? They'll say no. So if you want to do that, you don't want to see me, then you have to do these things that I have told you.
This
So
is, yeah.
maintaining, so meeting the doctor is not a good thing, obviously. So if you don't want to meet the doctor, if you don't want to visit the hospital, do the things that we just spoke about, good sleep, hitting the gym, and all these things will help with your metabolism, and you'll be very independent late into your 70s and 80s also.
Yes, very important. And I'm sure your client again comes with a drastic little gradual transformations, and you take the, yeah, yes. And I think that we should also start questioning ourselves about the same. Yes, yes. I think we are just coming to the nearing session now. Over to you, Monica, for the last slide. Yes.
Yeah. So like the session is very insightful. So just question comes in my mind, like now the people are using so much processed food. So
Ultra processed. Yes.
yeah, so this food is somewhere it's affecting our metabolism.
Yeah. So yes, there's
Yes.
a uh, just to give an idea, so that people get inspired by examples. So
Hmm.
there was a study which was done. Everyone, like 20 people, were given non-processed food, like just whole grain, and they were asked to eat how much
Hmm.
ever they want.
Hmm.
And the rest, another 20 people were given just ultra-processed food, and they were given a restricted calorie at like 2000 calories. They're restricted, then what, like a 500 calorie deficit. What they saw over a period was that the guys taking restricted calorie food on UPF gained more weight, and their metabolic markers were more worse than the ones who had that whole grain food or the non-processed food ad
Yes.
libitum, like how much ever they wanted. So
Yes.
I think that gives us insight that
Insight. Yeah.
consumption of ultra processed food is probably the worst thing you can do right now. Never
Yes.
ever take UPF food. Always read your labels. If it's having
Yeah.
a lot of
Hmm.
numbers like emulsifiers, INS 1518,
Yes.
all these things, ensure that you're staying away from those kinds of foods. Just eat foods that are natural and whole foods. It will help a lot.
Yes.
And that will help obviously with gut health as well. That
Yes.
is it.
So even I wanted to ask about this fermented foods. Nowadays we keep hearing and a lot of everybody just they are trying to use this and with the olden
Yes.
factors also. Yes. So what do
So
you?
the reason is in olden days in North India, I think you'll know there's a thing called kanji or
Yes.
kanji. I don't know how
Kanji.
it's
Yeah.
pronounced, like with carrots, the fermented
Ah,
carrots.
Hmm.
yes.
So what fermented foods do is when you take them, they produce what are called short chain fatty acids in the gut. And
Okay.
these short chain fatty acids, which is butyrate or propionate or acetate, help in protecting the gut from what is called as a leaky gut syndrome. So taking fermented foods like, kombucha or like the kanji or your buttermilk, just normal buttermilk, one glass per
Just yes.
will go a long way in protecting your gut health and ensure that you are, and everyone should know that 70 to 80% of your immune system is through the gut axis. So if your gut
Yes.
is not good, you see a lot of patients, they'll have acne, like skin breakouts, they'll have brain
Yeah.
fog, they'll have not good energy. So
Mm.
by consuming a high fermented food diet, you will protect the gut barrier and decrease the inflammation and ensure that you're metabolically well.
So again, one more concern. This is the last concern which I wanted to ask you is this consuming this buttermilk in a total in a 24 hours. What is the right time to consume? Like many people, they see maybe mid morning, maybe afternoon, or maybe post
Morning.
lunch.
Morning is the right
Morning.
time. Morning would be the
Yes.
right time to consume that. But of course, if you're not able to do that in the morning, even mid morning is a good time to have it.
Yes. Yes. So yes, as you said, we cannot just a lot of nice discussion we had, and we have learnt a few very things which we were not aware of, and yes, a very long way to go for awareness. Yes, so yes, thank you so much for your very productive, valuable time. I thank to speakers also, and I request all the viewers to just refer www.yashodahospitals.com for more academics and health update, also patient testimonials. As I was just going through a lot of your talk and the podcast and your short reels, yes, very inspiring they are, and we urge it to the viewers also same. And we end the session. Thank you, everyone.
Thank you for having me.
Thank you.
Yeah.
Thank
Thank
you,
you, ma'am.
Monica, and thank you, Sumitra.
Yeah.
Yes.
Thank you.
Thank
Thank
you.
you.
Thank you, ma'am.
Thank you,
Thank
sir.
you.